This is what it looks like when the government decides that poor people do not deserve health care. 10 million Americans are about to lose their health insurance, not because they committed a crime, not because they stopped paying premiums, not because they no longer need care, because they cannot prove they worked 80 hours last month. You thought Medicaid was a safety net for the vulnerable. You thought the government would not deliberately throw millions of people off health care. You were wrong. In this special report, we are going to break down the largest cut to Medicaid in the program's 60-year history. We are going to show you exactly who will lose coverage and why. We are going to expose the work requirements that experts say will accomplish nothing except paperwork. And we are going to explain why hospitals are already cutting staff and services in anticipation of the coming catastrophe. July 4th, 2025. Independence Day. The One Big Beautiful Bill Act was signed into law. The name sounds optimistic. The reality is devastating. The law cuts nearly $1 trillion from Medicaid over the next 10 years. $1 trillion. That is not a typo. That is the largest reduction in federal health care spending ever enacted. The Congressional Budget Office estimates that 1.3 million Americans will lose coverage in 2026 alone. By 2034, the total number of uninsured will grow by 10 million people, possibly more if states cannot absorb the costs. These are not statistics. These are your neighbors, your family members, the person who bags your groceries or fixes your car or watches your children. Medicaid covers 70 million Americans. That is more than 1 in 5 people in this country. It covers children, pregnant women, elderly adults in nursing homes, and people with disabilities. It covers the working poor who have jobs but whose employers do not provide insurance. All of them are now at risk. The centerpiece of the cuts is something called work requirements. Starting January 1st, 2027, most Medicaid recipients between 19 and 64 will need to prove they worked at least 80 hours per month to keep their coverage, that is 20 hours per week, every week. Documented, verified, reported to the government. If you miss 1 month, you lose coverage. If your paperwork is late, you lose coverage. If the system makes an error, you lose coverage. And once you lose coverage, you cannot simply re-enroll. You have to file a completely new application. You have to go through the entire eligibility process again. You have to wait while bureaucrats verify your work status. If you get sick during that waiting period, you are on your own. The administration claims work requirements will encourage employment and reduce dependency. This is a lie that has been tested and disproven multiple times. Arkansas implemented Medicaid work requirements in 2018. Within 3 months, 18,000 people lost coverage, not because they were not working, because they could not navigate the paperwork. A study found that most people who lost coverage were actually employed. They just did not understand the reporting requirements, or they missed deadlines, or the online system did not work properly. There was no increase in employment, none. The only thing the policy accomplished was taking health care away from working people who made paperwork mistakes. The Arkansas experiment was stopped by a court order, but the lessons were apparently not learned, because now the same failed policy is being implemented nationwide. Georgia tried a different version of work requirements. The results were even more absurd. The state reportedly spent nearly 5 times more on implementation costs than on actual health care services. They created an entire bureaucracy to verify work hours that ended up covering almost nobody. This is what work requirements actually do. They do not encourage work. They create barriers. They punish people for being poor. They transfer money from healthcare to administration. The exemptions are narrower than you might think. Yes, people under 19 are exempt. Yes, people over 64 are exempt. Yes, tribal members are exempt. Yes, parents caring for children under 14 are exempt. But what about the 55-year-old with chronic back pain who cannot work full-time but does not qualify for disability? What about the 25-year-old caring for an elderly parent? What about the gig worker whose hours fluctuate week to week? The law says people who are medically frail are exempt. But who decides what medically frail means? How do you prove it? How long does the verification process take? Every exemption requires documentation. Every exemption requires someone to review it. Every exemption is another opportunity for the system to fail and coverage to be lost. The work requirements are just the beginning. Starting in 2026, the enhanced federal matching funds that incentivize states to expand Medicaid under the Affordable Care Act will be eliminated. States that expanded Medicaid have been receiving 90% federal funding for expansion populations. That drops significantly. Many states expanded Medicaid because the federal government was covering most of the cost. Now, those states have to choose between finding money in already tight budgets or kicking people off coverage. Some states have already made their choice. Idaho announced it will cut provider reimbursement rates by 3 to 10%. North Carolina is anticipating service eliminations and staff cuts. Colorado suspended planned rate increases and is cutting dental coverage. When states cut provider reimbursement, doctors stop accepting Medicaid patients. When doctors stop accepting Medicaid, people with coverage cannot actually use it. Insurance that no one will honor is not really insurance at all. Starting October 1st, 2026, Medicaid eligibility will be restricted for certain immigrants. Currently, refugees, asylees, and trafficking survivors can qualify for Medicaid. These are people who fled persecution, who were granted humanitarian protection by the United States government, who America promised to help. After October 2026, most of them will no longer be eligible. Only green card holders, certain Cuban and Haitian entrants, and citizens of specific Pacific Island nations will qualify. A refugee family that escaped war, that was vetted for years before being admitted, that is trying to build a new life in America, will lose their health care because of where they were born. This is not about fraud. This is not about eligibility verification. This is about telling vulnerable people that they do not belong here. The eligibility checks are being accelerated. Currently, states verify Medicaid eligibility once per year. The new law requires verification every 6 months. This might sound reasonable. Check more often, catch problems sooner. But in practice, more frequent checks mean more opportunities for people to lose coverage through administrative error. Every check requires paperwork. Every check requires processing. Every check is a chance for something to go wrong. A letter gets lost. An address changes. A document is misfiled. Coverage ends. Studies of Medicaid unwinding after the pandemic showed that the vast majority of people who lost coverage were still eligible. They lost it because of paperwork problems, not because their circumstances changed. Doubling the frequency of checks will double the opportunities for eligible people to fall through the cracks. Starting October 2028, Medicaid recipients may be required to pay copays. $35 per service. $35 does not sound like much if you have money, but for someone living at or below the poverty line, $35 is groceries. It is gas to get to work. It is the difference between paying rent and falling behind. When you require poor people to pay for health care, they stop seeking health care. They skip preventive visits. They ignore symptoms until they become emergencies. They show up in emergency rooms with conditions that could have been treated cheaply if caught early. This does not save money. It shifts costs. It turns manageable health problems into catastrophic ones. It fills emergency rooms with patients who should have seen a primary care doctor months ago. The hospitals know what is coming. The Commonwealth Fund estimates that Medicaid cuts in 2026 alone could cost states nearly 900,000 jobs. Not just healthcare jobs. Jobs throughout the economy as healthcare spending contracts. Rural hospitals are particularly vulnerable. Many are already operating on thin margins. Medicaid is a significant portion of their revenue. When that revenue disappears, so do the hospitals. We have already seen rural hospital closures accelerate over the past decade. This will make it worse. Communities that already struggle to access health care will find themselves with no options at all. The administration says this is about reducing waste, fraud, and abuse. But the work requirements do not target fraud. They target everyone, including the vast majority who are legitimately eligible and legitimately in need. The eligibility checks do not catch fraud. They create paperwork that trips up honest people who cannot navigate bureaucracy. The cuts do not eliminate waste. They eliminate care. If you wanted to reduce fraud, you would invest in verification systems. You would hire investigators. You would prosecute bad actors. Instead, the law cuts administrative capacity while adding administrative requirements. It demands that understaffed agencies do more with less. It sets up systems that are designed to fail. The cruelty is the point. These policies do not save money in the long run. They shift costs from the federal government to states, to hospitals, to emergency rooms, to families who go bankrupt from medical bills. They do not encourage work. They punish people who are already working by demanding they prove it every month. They do not reduce dependency. They create desperation, but they do accomplish something. They make it clear who matters and who does not. They send a message that if you are poor, if you are sick, if you are vulnerable, this government does not care about you. States are scrambling to respond. New Mexico's governor called a special legislative session to address the funding crisis. Arizona's Medicaid program has requested $71.4 million just for implementation costs. Experts warn that states are not prepared and will not be ready by the deadlines. The law requires outreach to Medicaid recipients between June and August 2026 to inform them of the new requirements. That is 6 months from now. 6 months to build systems, train staff, and contact millions of people. When the deadlines are missed, when the systems fail, when people lose coverage through no fault of their own, the administration will blame the states. They will blame the recipients. They will blame anyone except themselves. What can you do? If you are on Medicaid, make sure your contact information is current with your state agency. Respond to every notice immediately. Keep copies of everything. Document your work hours obsessively. If you know someone on Medicaid, help them understand what is coming. Help them navigate the paperwork. Be their advocate when the system fails them. If you vote, remember who did this. Remember which party passed a law that will throw millions of people off health care. Remember which party celebrated Independence Day by signing a bill that makes America sicker. 10 million people will lose coverage. Hospitals will close. People will die. Not because we cannot afford to help them, because we chose not to. This is the one big beautiful bill. There is nothing beautiful about it. The math is simple and brutal. Medicaid costs money. The federal government does not want to spend that money anymore. So they created obstacles that will cause people to lose coverage while allowing politicians to claim they never took health care away from anyone. Nobody voted to kick 10 million people off Medicaid. Nobody campaigned on letting sick people die because they could not navigate paperwork. But that is what will happen. The work requirements will be blamed on personal responsibility. If you lost coverage, it must be because you did not work hard enough. Never mind that you were working. Never mind that the system failed. Never mind that the requirements were designed to be impossible to meet. The administrative burdens will be blamed on individual failure. If you missed a deadline, if you did not submit the right form, if your eligibility was not verified in time, that is your fault. Never mind that the state was understaffed. Never mind that the process was deliberately opaque. This is how you dismantle a program while pretending you did not. You do not repeal it. You make it unusable. 60 years ago, Medicaid was created because America decided that poverty should not be a death sentence, that children should not go without doctors because their parents were poor, that elderly people in nursing homes deserve care regardless of their savings. That consensus is being dismantled, not through honest debate, through bureaucratic warfare. The one big, beautiful bill, there is nothing beautiful about it.